All right, so today we are talking about men and women's health, and of course, this is a very, very broad topic. So we want to kind of narrow this down just a little bit, but it's very important. You know, men and women's health, it affects everybody. So I'm going to introduce some of the doctors first. We're going to start on the far end. We have Dr. Amar Hussain, who is a primary care physician, right?
Yep.
Yep. And then next to him, we have Alicia Mingo, who is a doula. We got a doula in the house today, so and we're going to get her first-hand perspective on all of that, so that's really cool. And then next to her, we have Dr. Yvens Laborde. I get that right? And you are the Community Chief Medical Officer for Ochsner Health. And then last but not least, we have Dr. Latasha Upton, the Chief Medical Officer for St. Mary Medical Center. All right. So, yeah, we got some good stuff to talk about today. I'm actually going to start with you, Latasha. We're going to start with some questions, kind of talking about pregnancy and things like that. So my first question for you is, what health concerns do most women ignore that can ultimately affect their health and their chances to get pregnant?
All right, so that's an excellent question. Health issues that are often overlooked by women include abnormal uterine bleeding, and I'll say sexually transmitted infections. And so like abnormal bleeding, the menstrual cycle, if it's irregular, it can indicate other issues that could be going on. Like if it's, too heavy, lasting too long, then it could be issues with like ovulation. There could be the presence of uterine fibroids that can sometimes go undetected, which could affect fertility. And also, irregularities can indicate issues with ovulation, which could in turn affect fertility. And the other thing I mentioned was sexually transmitted infections. A lot of the times those infections can be asymptomatic, meaning the individual does not have symptoms and they don't know that they have them. So if you don't get tested, you don't know, but it can have long-term effects on fertility and make it, very difficult, if not impossible, to get pregnant.
Oh, that's some good information there. And what are the most common myths? This is a good one. What are some of the most common myths or maybe misconceptions about childbirth?
Okay, so when it comes to childbirth, common misconceptions would be when women have like an idea of how the childbirth process is supposed to go. That can be very misleading. Everyone's birth experience is different, and a lot of the times people, base their thoughts on what they see on television or the experience of a friend of theirs, and they can't do that because pregnancy, it's an individual thing based on your health conditions, okay? And the labor and delivery process can be very unpredictable. Sometimes it's beautiful and it's smooth and things go perfect, but other times, obstetrical emergencies can happen that require intervention by a physician. So that's what is commonly misunderstood.
Yeah. That's good. And for an advanced maternal pregnant mom who feels nervous or overwhelmed about the whole thing, about screenings, what would you say to help ease their mind just a bit?
Okay, so first, that's an excellent question. Advanced maternal, that means any woman that is pregnant that's 35 years of age or older, okay? And a lot of women, they do have a level of anxiety when they hear that term, that medical clinical term, but it doesn't necessarily mean that, something adverse is going to happen with that pregnancy. It just means that for that pregnancy, as a physician, we're going to monitor you more close, okay? And look for things because, risks are there. With age. However, it doesn't mean that a poor outcome is going to occur. So, I would say that it just means that we're monitoring you more close, and it's okay to ask questions. It's okay to ask your physician, like, what tests are being done? Why is this being done? If I say yes to this, what does that mean? If I say no, to this, what does that mean? So always, inquire about what's happening and what's occurring and what we're doing with the information that we get from each test. So,
No, that's, yeah, very important. And so we kind of touched on this already maybe a little bit, but what are some avoidable health issues, that you see in women that they can avoid by simple things? Life changes maybe, things like that?
so yes, health issues that are determined by like lifestyle and just life choices, okay? So things like obesity, hypertension, which cardiovascular disease. Everyone knows that, cardiovascular disease is the #1 killer of women. So lifestyle changes and modifications are things that we can adapt that can affect those things.
Yeah, and by those lifestyle changes, improving your lifestyle, that also might help the actual childbirth process, correct?
Absolutely, absolutely. So the healthier you are, the more, likely that the birthing process will go smooth.
All right, thank you so much. That was really insightful. Now we're going to move on to Dr. Evans, and we're going to kind of pivot just a minute and talk about men's health, and we're going to go back to women's health. We're going to kind of go back and forth a little bit. So firsthand, I can tell you firsthand, I'm one of those people that avoids the doctor, right? And there's no real reason for it. It's one of those things where it's kind of like the unknown. You're kind of fear of the unknown, and I'm healthy as far as I know, but it's like the what if. What if they find something, or what if something's wrong that I don't know about? I think a lot of people kind of worry about that thing. Maybe it's just me, but a lot of times you can avoid the doctor just because of, you don't want to know maybe if something's wrong. You just kind of want to put it aside. So kind of starting with that, I kind of have like a personal connection to this, but what is one thing you wish men that are in this room right now would do this week when it comes to health screening?
It's a good question. Can anybody hear me okay? I think that was really great, Dr. Upton, to change the thoughts that you changed. But I want to make a little bit of a general comment.
Yeah.
I mean, I'm glad that we're doing this today for a number of reasons, and I'm glad that we're talking about men and women's health, because I think sometimes we need to make sure that we all understand there's a difference between health and health care. So there are issues that are specific to men and women, but the fundamental thing is health. And I think everybody needs to kind of understand what the definition of that health means, because we're all in healthcare and we're all here doing all of this, but I think it's important that people understand that health in and of itself has a specific definition. And I'm going to get to your question, but I think everybody should, if you walk away with anything from here today, is to understand when we talk about health, health is defined by the World Health Organization, and that definition was established in 1948. And if you walk away with anything, health actually is described as a state of complete physical, mental, social, and spiritual well-being, and not merely the absence of physical disease or infirmity. I know that was a lot, but I think it's important that we understand that, healthcare, which is very important, is only a small portion of our overall health. And when it comes to men's health, it's really problematic because men have a tendency, and I'm one of them, right? So, present company included, we have a tendency to not prioritize our own health and well-being. And that's not because we don't care about our health, because the studies have actually shown that men are more likely to not seek medical help, men are more likely to ignore symptoms, and men are more likely to present with symptoms when they're far more advanced. And there are a number of reasons why that is. Part of it is a fear of the unknown. And so a lot of people, well, I don't know, I don't want to find out. That's not a good way to approach it. But the other thing too, it's not individual to the men themselves. It's just like the society as a whole has not created an atmosphere or culture where it's normalized for men to seek their own health and health care. So we have to individually change our ways and our way of thinking, but also collectively as a society, we have to actually create the environment for men so that men feel comfortable to go to a doctor, to have those discussions. And so I think that will take away some of that fear, or that stigma, or that unlikely, or that unwillingness or uncomfortableness that you may have about going to see a doctor.
Yeah, I mean, that's a really interesting because I didn't know that myself, and I'm sure a lot of men here didn't know that. I thought it was simply due to a fear of going to the doctor, but there's a lot of other reasons why men tend to push their health care aside a little bit, right? And so basically, for the men here, what do you wish that they would do this week when it comes to their screening?
Yeah. No, that's an excellent question, because I mean, you come here, so we don't just want to talk, because there's a Latin word that says acta non verba, like act, not just words. So the one thing that I would want everybody to walk away here today as an action plan, right? If you've not seen your doctor, or if you don't have a doctor, if you've not had a checkup in the past year, I would expect or would encourage you or encourage you to do that. If you were going to walk away with one thing here, is to make a decision that if I've not seen a doctor within a year, that I'm going to see my doctor. And once I've seen my doctor, I'm going to know my numbers. Essentially know your numbers. And when we say, you know your blood pressure, and Steve's going to talk about that a little bit more, but just know your numbers. Make sure you go to a doctor if you're not seeing one. And when you go see the doctor, make sure that you know your numbers.
And by numbers, and we're going to talk to Dr. Hussan a little bit more about this, but by numbers, are you talking more just like, we'll get in more detail, getting a blood panel, things like that?
Yeah. So Dr. Hussan, can you maybe comment on what that would?
So there's a lot of different numbers. We do follow labs for numbers and stuff, but we follow the patient in a holistic approach, the whole body approach, right? So from top to bottom, we check their cholesterols, like, hey, we want that, like they say, bad cholesterol, the LDL cholesterol, we want that under 100. We want your triglycerides under 100. We want that good cholesterol, the HDL, above 40. How do you do that? You do exercise, right? We want your blood pressure per JNC 8 guidelines. What do they want? We want everybody's blood pressure that's under 60 to be 140 over 90, below that. And anybody above, we give them a little more leeway. We want their blood pressure less than 150 over 90. There are some intricacies in there, but we follow that. And then we follow the thyroid, we look at that, we look at the blood sugar. Like, hey, are we pre-diabetic? 5.7 to 6.4. Are we diabetic? 6.5 and up. But what does that really mean? It means that, hey, we're having an intolerance to sugar. So that means we have to do lifestyle modifications. We have to eat healthier. We have to exercise. All that stuff is important. What our main thing is as primary care providers is to make sure you don't go to the specialist. So we help you in the sense of gearing towards your preventative medicine, okay? What can we prevent so we don't get the cancers, or we don't get the strokes, or we don't get the heart attacks? How can we help you empower yourself? One of the biggest things that all these physicians here sitting and all the providers want is the best quality of life for you guys, right? And how can we do that? How can we help you enjoy your time with the kiddos, enjoy time with your sisters and brothers, with your grandparents, with your parents, with your siblings? And that's by giving you the best tools to help you help yourself, empower yourself to have the best health. Okay, and that's all we want. We have different ways to do that, but at the end of the day, it's about giving you the best health that you can have.
Awesome, thank you so much. And we're talking, Dr. Laborde, prostate exams. That's probably one of the most important, it's one of the most important things that a man can do, especially as they start to get a little bit older in life. But so how important are prostate exams?
Well, kind of following what Dr. Hussain had said, it's critically important because prevention. Because really, like, a lot of times they say an ounce of prevention is worth a pound of cure. And when it comes to cancer and disease prevention, prostate is one of the most common cancers in men, obviously. And actually, when it comes to, African American men, you're 2 times more likely to die of prostate cancer, and you're 70 times more likely to develop prostate cancer. So the importance of screening for that is critically important. And so the recommendation is, if you're high risk, and basically if you're African American, you're high risk. If you have a family history, you're high risk. And so the importance of getting that screen is really important. So there are 2 things you can do. There's a test called a PSA, which is a prostatic. So when we talk about knowing your numbers, if you're a male And if you're above 40 years old and you have high risk, you should know your PSA. And so those are two, as he had said, the screening tests that you can do. So you need to have, so the prostate exam and the PSA, if you are at high risk and if you're 40 to 45 years old, the new recommendation is at 45, everybody who's at average risk should get a PSA test done. You should not having that conversation with your physician at 40. So extremely, extremely important for all men, but particularly in African American men, because again, the likelihood of your getting prostate cancer is 7 times higher, and then the likelihood of you dying from it is 2 times higher. And the earlier that you actually detect it, 5-year mortality with early detection is almost 100%. So if you detect it early enough, the likelihood of you getting cured from it is 100%. And so if you tie that with what I said before about the likelihood that we tend to not, and there are no symptoms. Most of the times, if you're not screened, you won't necessarily have a symptoms. And when you start having symptoms, typically, to the point we want to prevent, it's too late. We want to detect it before you develop symptoms.
And early detection, we're going to be hearing that a lot. I mean, that's key, right? So we kind of talked about this earlier, but is this a myth or is it true that it is difficult to get men to take their health seriously until it's too late? We kind of were just touching on that a little bit.
It's not a, part of it is true, because the data actually has proven that men are less likely compared to women to go to the doctor. We're less likely to go when we have symptoms, and we're more likely to delay care. So there is some fundamental truth to that, because the data has shown that. The myth about it is the fact that men don't care about their health. That is absolutely untrue. We care about our health as much as anybody else. But the fact of the matter is that there are certain barriers that oftentimes prevent us from seeking the health care and the care that we need. A lot of times, men don't necessarily have a relationship with their physician. They're not necessarily comfortable with health care to begin with. Sometimes the healthcare facilities won't make it appealing for a man in general to go to the doctor. So the myth is the fact that we as men are not prioritizing care about our health. That's not true. There's some societal constraints that make it a little bit more difficult sometimes for us as men to get the care that we need. So that's a myth. We care about our health as much as anybody else. But the fact is that we do have a tendency to not seek the care at the time that we need it as frequently as we need to have it, because men are less likely to have a primary care doctor as compared to our female counterparts.
Gotcha.
If I might just interject one thing. You know, we know how busy you guys are. Everybody has to go to work. Everybody has children. Everybody has different things they need to do. At the end of the day, we want you in the clinics. We know how valuable your time is, right? But we want to be able to help you maintain things. We want to be able to get the baseline things for you. We want you to know and be informed about your health, right? Like one of the biggest things, it doesn't matter if it's male or female, right? Blood pressure is going to affect you the same way. The sugars is going to affect you the same way, right? Strokes are going to happen. Things are going to happen. All of us sitting up here, we're humans too, right? If we don't maintain ourselves, we're going to get in trouble as well, right? Nobody's to say what positions you guys are in. We up here won't be in those positions, right? So we have to help each other be the best form that we can be, right? And one thing I want to educate everybody on is snoring, right? Sometimes, you know, our significant other says snoring is, you know, you're so loud. You know, why are you so loud when it comes to snoring? You're bugging me. Go sleep in the other room. But that's a medical condition. It can be, right? So it needs to be evaluated. Why? Because it can increase the risk of you getting diabetes. It can increase your blood pressure. It can increase you to be more tired and, God forbid, get into car accidents or not focus at work and get in trouble from work, right? So obstructive sleep apnea is a really big thing. Like Dr. Upton initially said, you know, obesity has a lot to do with it as well, right? So we need to help you guys be the best you can be. All right? All these labs, everything we do, we get educated on, but again, it's because we want to give you the best care we can, the best standard.
Awesome. Thank you so much. That's good information. So we're going to pivot just a little bit, and we're going to actually go back to women's health. And we have a doula in the house. This is Alicia Mingo. Thank you for being with us. So I got some questions for you, since it's you have the firsthand perspective on all of this. So what role does the doula play in women's pregnancy?
Wonderful, and thank you guys so much for having me here. So what role does a doula play? We offer emotional support. We offer just support in every way that you could possibly need outside of the clinical things. We leave those things up to Dr. Upton. So really that emotional support, making sure that you feel heard, making sure that you are also being listened to, but then also I like to put a little bit of extra nurturing and compassion on there.
Okay, great. So another question for you. Are doulas allowed in the hospital setting? Anyone want to interject?
So yes, doulas are allowed in the hospital setting. We are actually considered a part of your healthcare team. So we work with when we're there, I guess I should say, we are working with your healthcare team, we're working with your doctors to ensure that your environment is very comfortable, it's very loving and soothing for whatever that particular mom or birthing person may feel or desire to have as their sacred space, what some people call it, during the birthing time.
So how would an expecting mother know that they need a doula?
Okay, well, everyone needs a doula. I'm just going to put that plug there, and I'll just give you a brief story about myself. My husband is in the audience with all three of our children. And so after my first delivery, we had major support from family. My mother-in-law came over to the house. She cleaned the house from top to bottom with my sister-in-laws. Our church family was very supportive of us. They brought us food. I mean, just basically all the things that you would think that you would need, right? And so after a while, as I was just kind of looking through and thinking about my pregnancy, thinking about my delivery, and thinking about coming home, I just felt like there was something that was missing. So I'm also a nurse, just FYI. And I remember reaching out to one of my instructors, and I was like, y'all didn't tell me something, And even speaking with my mom, I was like, y'all left a lot of things out. Well, fast forward a few years down the line, I became a healthy birth ambassador. And during that training, everything that I thought I missed is what I found what a doula does and how they offer that support. And so when we think about like some moms and we think about even dads, a lot of the time when we hear about healthcare and we hear about pregnancy, a lot of the focus is on the mom and the baby. It's focused on the dyad instead of actually focusing on the triad, which is a lot of what we do. And I'm the owner of Happy Healthy Pregnancy. Is what we do is making sure that we are focusing on the support system as a whole. So when you talk about men's health and men's mental health and well-being, that becomes a big part of what this pregnancy looks like for mom. And then what, life essentially will look like for the baby once the baby is here. So everyone needs a doula. Everyone needs a doula that leads, let me say, foremost with kindness, compassion, definitely being competent and educated on what pregnancy looks like, what the birthing process looks like, and then also in that, postpartum phase, because those are all so important transitions.
Thank you, Alicia. We appreciate it so
You're
much.
welcome. Thank you.
Now we're going to go back to Dr. Husan. And I wanted to ask you about, for someone that hasn't had a physical in a while, this is just kind of a general topic, but what do you look for in a general physical when someone comes in?
Yeah, so a physical is important, right? So I like working on cars, right? So let's talk about a car, right? We want to do maintenance on the car. We want to have the oil change. We want to have the car have a tune-up. We want to make sure things are good. The brakes are good. Everything is good, right? So when we're doing a physical, we go head to toe, right? We listen to your heart to make sure you don't have a murmur. We listen to your lungs to make sure there's no wheezing or consolidations. We look in your ears to see if your tympanic membranes are good. If there's wax in there, can we get that wax out? Maybe that's not out why your husbands or significant others aren't listening. Sometimes it's just universal, but sometimes they can have earwax in there. So we try to help in that sense. We make sure you have a good neurological exam where there's no deficits in your vision, there's no deficits in your fine touch. We make sure your hair's not falling out by actually pulling it out, right? We listen to your stomach to make sure your bowel sounds are good, that you're not constipated, or there's no masses on your stomach. So again, we look at your pulses, make sure your pulses are good, blood flow is going appropriately where it needs to go. So we're doing a lot of different aspects, especially we're looking at your vital signs, your blood pressure, your heart rate, we're looking at, your temperature, we're looking at your oxygenation, how good your lungs are oxygenating. So there's a lot of different aspects that go into just doing a physical. And then on top of that, according to that, when you tell me your symptoms, hey, Dr. Hassan, I'm tired. Okay, well, let's look at your TSH to see if your thyroid is kind of messed up. Let's look at your testosterone. Maybe that's kind of not where it needs to be. Let's look at, see if you're anemic and get a CBC, right? Hey, Dr. Hassan, I'm having numbness in my legs. Okay, well, let's look at, if your sodium, your potassium, your magnesium, all that stuff is going good. Let's look at your kidney functions. Let's look at your liver functions. And all that stuff is accessible and things that we could do in a few minutes, right? So evaluating you, the vehicle, meaning the individual, starts from head to toe. And we give you the time that you actually need.
Now, how often would you say how often should he be getting a physical?
Yeah, so that's a good question. So now the answer is it depends. You hear once a year you need a physical, that's good. But depending on the comorbidities you have, say you have diabetes, say you have hypertension, say you have COPD, say you have heart disease. So dependent on that, you might need a physical exam sooner than not, maybe 6 months, maybe 3 months. So it's all personalized to you, the individual, and what we can do to make sure you are having the optimum health.
Okay. And just a few more questions. This is just mostly stuff that I have, but I'm sure if I have these questions, a lot of other people do too, right?
Yeah.
So you were mentioning blood pressure earlier. Is an ideal blood pressure, is that different as different people age? Is an ideal blood pressure, say at age 60, different than an ideal blood pressure at age 30 or something like that?
Yeah, so like I said initially, we follow JNCA guidelines, we follow cardiology guidelines. Usually they say anybody under 60, we want their blood pressure to be less than 140 over 90. And if you're above 60, we give you a little more leeway and we say 150 over 90, less than that, right? So as you kind of grow older, say 60, 70 years old, your arteries and your vessels kind of thicken, right? So your blood pressure can be a little elevated. But again, blood pressure is dynamic. It goes up and down. What you want to realize is that, is it too high? Is it too low? And it's individualized to you. We can give you numbers, but let's say your blood pressure is 150 or 160 and you have headaches, right? So we need to address that blood pressure and get it down, right? So say your blood pressure is less than 100 or around 100, the top number. So that might mean we need to back off on your blood pressure and we need to maybe give you medications to help your blood pressure come up. Remember, blood pressure is considered the silent killer. You won't know until you start having symptoms, and you don't want to get to that aspect where, God forbid, you have strokes and you have heart attacks. I'm not trying to scare you guys, but at the same time, I'm trying to be real with you. You can ask these smart doctors that are sitting here. If we don't control that blood pressure, if we, eat all that salt and we're not on a good salt diet, and if we just let things go, you can get in big trouble. And that's where primary care comes into play, and physicians in general. Yes.
And I was actually just going to touch, but I'm going to open it up for Dr. Upton to touch on this, being that she is more so from the clinical perspective. Also, during pregnancy, your blood pressure is different, and it's very important. And I'm going to pass it off to Dr. Upton to really go into detail about it.
Well, yes. we do monitor blood pressure, and going into the pregnancy, we have to establish whether an individual has chronic hypertension or not, because in pregnancy we are always screening for preeclampsia, and some people will know that as hypertensive disorder of pregnancy. And the thing is that with preeclampsia, you can have a lot of end organ involvement and damage and end up having seizures. And we don't want that. Even a stroke could occur with, preeclampsia. And so we have to make sure that we know what kind of, health condition you're in going into the pregnancy. And then throughout the pregnancy, we're monitoring that blood pressure at every single visit. And, even our questions that we ask when you come in, if you're having a headache that's unresolved with, routine meds such as Tylenol, if you're having vision disruptions, these are all, screens for preeclampsia. And so, it's a really big deal. And women who have preeclampsia during the pregnancy, they are, more likely to have hypertensive disorders later, even when the pregnancy is over. So it's a big deal.
Yeah, and just also too to touch a little bit on awareness about postpartum hypertension, which is not something that we see as often, as preeclampsia, but it is something that still occurs, and it's still very important. So, we do encourage our moms to continue to talk with their physicians about their blood pressure. As a doula, we continue to tell our clients, hey, talk with your physician about this. Make sure that you're bringing those questions and speaking, with them. And so as a doula, one of the things I think I probably should have mentioned earlier is that studies show that if you have a doula throughout your pregnancy and even in your postpartum, that we can really help those outcomes and improve them tremendously. It decreases the rate of possible cesareans that may be needed. And we just help with all the other things with making life easier. But we're also that person that the parents feel very comfortable bouncing those what if questions about. They're texting you in the middle of the night or in the afternoon, or, hey, is this something that's important? And so sometimes, we're like, hey, that's very important. You need to call your doctor, or, hey, let's go ahead and call L&D. That's a real big one. And so just offering that encouragement and that support, and from a very non-judgmental, open, standpoint, and being able to point them back to their physicians. Some people think like doulas and doctors are against one another. No, when it's done right, we work collectively to make sure that we are serving the clients, that we are serving the patients, and that everybody is going home happy and healthy.
No, I was just going to say that, and the roles for, the physician and the doula, they're different. We work together, but we have different roles. So like the physician is more for like the clinical things and, medical judgment and things of that nature. And the doula is more of the holistic side and approach.
Yes.
You can speak
Yes.
more of that.
All of the feels is what we call it, the touchy-feely things.
No, that's because, medicine is a team sport. And so everybody has an important role that they play. The doulas have an important role. I guess I just wanted to see if the audience actually had any questions.
Ask any questions at all while you have the doctors here.
Is low blood pressure a problem, and what is low blood pressure? And what is the best number, or the most important number, the top number or the bottom number?
That's a very good question. Ideally, so we classify blood pressure, stage 1, stage 2. And so the goal, the ideal blood pressure, although it's different, is 120 over 80. 120 over 80 is the actual goal. You're absolutely correct that there is a condition called hypotension. And hypotension is a fancy way of saying low blood pressure. And there are different things that can actually, if you look at numbers, so basically 90 over 60 is is the number that you can kind of think about. If you're having symptoms at 90 over 60, we consider that a low blood pressure. And so there are a number of things that can actually lead to that. And so if you're dehydrated, sometimes the medications that you're on, there are a number of things that can contribute. Sometimes if you're having heart failure, that could be a sign of your heart not pumping ideally. So there are a number of things that can cause low blood pressure. So you ask some really, really important questions related to the blood pressure. And so I guess I'm going to pass to him, but one of the things I would like to say, because the blood pressure, when you think about it, it impacts every organ system in your body. There's not an organ system that the blood pressure does not impact. It impacts your eyes, it impacts your brain, it impacts your kidneys, it impacts the organ. Men know what I'm talking about. So it's one of these things. It's the number one risk, for hypertensive heart disease, for cardiovascular disease. And I'd let Dr. Hussein kind of add on that a little bit.
So, since he kind of alluded to that, talking about men's health, since we're talking about men's health, erectile dysfunction is a real thing, right? So erectile dysfunction can actually happen because of multiple reasons, right? It can happen secondary to you being depressed. It can be secondary to you having a sedentary lifestyle, meaning not really being active. But it could also be secondary to you having cardiovascular disease, right? Heart disease, that can be because, again, what is the heart? Simplistically, it's a pump, right? That's what, you have something called systolic blood pressure, the top number, you have diastolic blood pressure, the bottom number. How much is the heart pumping? How much is it holding? Those are the different things, right? So again, that's another reason to go to your primary care doctor. Hey doc, I'm not able to do what I used to do in the bedroom. That's fine, but that opens up a segue for us to address different things because it could be a lot of things around it. When you're asking about blood pressure, right? The hypotension, when you call it, like our senior doctor here said, it could be because you're dehydrated. It could be because you have blood loss. It could be because of your thyroid. There's so many different reasons, right? But we're looking at people that are symptomatic. Hey, when your blood pressure goes down, are you dizzy? Is your heart rate going up or down? All those things are important to see. And who's going to see those? The people that are trained to be able to assess those things and are able to help treat those things for you, right? Maybe that 90/80 blood pressure you have, maybe that's normal for you. And so if I bring it up to 130, 140, maybe you're going to have symptoms, right? But maybe that 90/80 is bad for somebody else, and it's a 70, 80-year-old young lady that it happens to. And because that blood pressure is low, she becomes dizzy and she falls. And God forbid she breaks a hip, right? It's going to be really hard for her to come back from breaking a hip. So much physical therapy, so much pain, so much anguish to get to her baseline again. So that's why we as primary care or physicians in general look at all different factors that affect that one factor. And we try in a holistic of approach to be able to give you the best life that you can have.
Well, honestly, I feel like, go ahead.
I was just
Yeah,
going to
go
say that, the biggest thing is this. Everybody in here today needs to just really realize you need to get a primary care physician. You need to be comfortable with your primary care physician because, we can give you the references, like the numbers that, the baseline numbers or the recommendations, but every person in here has to have individualized care, okay? So what, my normal is going to be different from his normal and her normal. And a physician is someone who is trained to know what's going to work for you. And then they can educate you on that. So it's really good to just, get in with someone who you can talk to, you feel comfortable asking questions, because that's the way you're going to get the best outcome for you. And overlying theme or, things that you'll hear us say, we like to screen so that we can find things early on because, prevention and early detection is always best.
And I feel like we could continue this conversation for easily another hour. I think we're a little bit over on time, which is good. This was a fantastic conversation. But I just want to thank all the professionals that came today, the doctors, and Alicia, thank you for coming in. I think hopefully you guys learned something. Yeah. And I think it's a really cool event what we're having today to actually get the perspective on multiple professionals at the same time and ask questions. And I wish we had more time to ask more questions, but I think we're a little bit over on time. We got a few more fantastic talks coming up throughout the rest of the day. So
Can I just say one thing?
yeah, go for it.
That young doctor that's sitting over there, Dr. Latasha Upton, she's an amazing OB-GYN. She delivered both of my kids, and she's just amazing. So I just wanted everybody to know, and she's just, that smile, she's beautiful, and she has the brains, so definitely go to her.
Well, thank you guys. We really appreciate it. Thank you.